Good evening, good evening, good evening, and welcome to blackdoctor.org. I am Ellis Dean, a project manager with blackdoctor.org. And, this is one of our favorite. I got something on my face. What is that about? Okay. So, one of the things we'd like to do is we have some special contributors that we really enjoy that are wonderful contributors. And I don't know if y'all remember, way back when I first started with Black Doctor, she was my first interview. So I'm very, very excited to have it. 2 days on the job, and I got to interview the most wonderful, spirited person, knowledgeable, beautiful, both inside and out, and just so excited to have her come here with a new regular appearance that we're going to have. And we're going to call her show House Call because Dr. GiGi or Dr. Jihan El Bayumi at the Rodham Institute is like having an aunt as a doctor. And she is so warm and so loving and so knowledgeable that we are so excited to have her and kind of debut her show called House Call with Dr. GiGi. And so let me shut up and bring her on.
Good evening, Dr. how are
GiGi.
you?
How are you doing?
Good. Of all the roles that I play, Auntie is my favorite. So thank you for that. I really appreciate it. Because, Auntie is like, first of all, I'm the cool aunt, right?
Yep.
People can come and I don't have the same responsibilities that parents do.
Exactly. Exactly. So I was like, yeah, I want to go hang out with my aunt. I'm going to Auntie's house.
There you go. Exactly.
Absolutely excited to have you here this evening.
Thank you.
First show. So first off, I don't know if y'all remember. So I'm going to kind of do a recap. So my first interview with Dr. GiGi, we were talking about her cancer journey because she's had kidney cancer, and for those that don't know, she is a survivor of breast cancer. And so we were really kind of talking about her process of going through the therapy and going through treatment and that thing. We did some updates, and so we got this. So I'm going to say I know what the answer is, but I'm going to ask the question for our audience. How are you now? How are you in your recovery going right now?
Well, thank God I'm fine. I am exceedingly lucky because, of course, I used my privilege as a doctor to navigate during the triple pandemic of COVID and the serial murders of Black people and Trump. It was very tough to do all that, because I was diagnosed in July and was able to get treatment right away. I got chemo and then I had to have my kidney removed, and thank God, no more cancer. And I'm actually enrolled in a clinical trial where I'm just being observed over at the NIH. So I feel very lucky. And, of course, the treatment by the healthcare team is one thing, but what I believe is that all the love and support and prayers are really what cured me. So thank you for asking. Thank you.
No worries. We're very, very happy. And so for everybody that's watching, in the comments, just drop where you're watching from. We'd like to see where people are living and kind of talk about what's going on in your area. So if you just give a shout out, give us your name and say, hey, dropping in from Columbia, South Carolina, Charleston, whatever, DC. So just leave that in the comment section. We'd like to see where people are watching us from. So, we can't be blackdoctor.org and not talk about the biggest albatross that's kind of hanging around all of our necks, which is the COVID, right? And it feels a little bit weird to think that this is February and this is when the COVID conversation of last year started really picking up steam. And it didn't feel real then, but it's very real now. And what we're looking at by real, it's just 500,000 deaths, right? And it's hard to even wrap your mind around it. Around 500,000 people dying from COVID-related complications. And I think I have to make sure we say it that way because people aren't dying specifically from COVID. They're dying from complications that are, as a result of catching COVID. And so, what are your thoughts about where we are in February of 2021 versus where we were a year ago at this time?
We're in bad shape. And really, it's because of the irresponsibility for what I also call passive genocide. There was a real decision, a calculated decision that was made by the previous administration. They looked at who was dying. And so Black and brown communities, people that were older with pre-existing conditions, And they said, well, you're not really dying from COVID, you're dying of the pre-existing conditions. So one of my best girlfriends said, that's like saying if you take a flight and you've got diabetes and the plane crashes, that you died of diabetes and not plane crash, right? It doesn't make any sense.
Right.
But really, I mean, the vast majority of these deaths were preventable.
Mhm.
And that's the sad part, because these are people's aunties and uncles and brothers and sisters and, parents and cousins and friends. I mean, I had clinic today, and I always ask my patients, and I have a predominantly African American patients that I take care of. I'm like, first question, I'm like, how are you doing? How's your family? Have you lost anybody?
Right.
And people will tell me, yes, my cousin, my, grandparents. Somebody I was talking to just before we came on air, she had lost her mother in June. I mean, it's bad. And then I think the thing that makes it even more difficult is that, we as people, as human beings, but especially those of us of African descent, the way that we deal with with anything good or bad is that we celebrate or we grieve, right,
Right.
together. And
Right.
those rituals and those, occasions have really been completely yanked from us. So even in the grieving process, we're doing it alone. We don't have the support. I mean, just the physical comfort of being hugged and to
Right.
cry on somebody's shoulder, we're missing all of that. So, we're seeing a lot of suffering, and it's a horrible number. But I think we now have an administration, and of course the Biden Harris administration, in which you have people there and also good representation because of diversity, which is why it's
Mhm.
important, because it makes a difference in how all of Americans are taken care of, not just a subgroup.
Yeah.
So I'm optimistic, but that doesn't take away from the deep sadness I feel for all the lives that have been lost.
Absolutely, absolutely. And so, and that's the second question. And shout out to everybody from Opelika, Alabama. Shout out to so a couple of DC residents. We got people from all over. So hey, Lynn, how are you? Keep dropping your cities in there. But also, I want people, if you would, just let us know. You can just answer by simply saying yes or no. Do you know someone that has contracted COVID? Um, that's the question for the comments. So just put yes or no if you know somebody, because we'd like to get a good gauge on really how close is this getting to home, right? Because we're talking about 500,000 deaths, but we're talking about how many millions of infections. And so thankfully, people have survived COVID. Thankfully, people have survived COVID, but it really is, it's hard to wrap your mind around the number of people that have passed away. You think about that's what happens in world wars. That's not what happens with disease or tragedies like this. So
And actually, to your point, Mr. Ellis, it's not just people who die. Just like with war, people come back disabled,
mhm,
our vets that come back, and COVID is no exception. We now know about the long haulers syndrome, where people have continuing chest pain or shortness of breath. People can have had strokes. I know somebody's mom, who I just was talking to yesterday, she lost part of her leg and then had a stroke. So these are things like, yes, you can survive, but are you able to really resume your life? Do you have the same quality of life? And so the 500,000 is just it's a hard endpoint of deaths, but
right.
we know that there's a lot of, other kinds of conditions that are not captured by that number.
Absolutely, absolutely. So this feels heavy, but it is a heavy subject, and it's something that we have to deal with every day. Every time we step outside of our homes, we are in jeopardy if we are around other people. And we have to wear those masks. We have to wash our hands. We have to watch our distance from others. And that is kind of that's been the fail-safe that has finally kind of kicked in. I know early on that was kind of in debate, but I think right now, for the most part, people have accepted those three things as being kind of the first line of action against COVID.
Mhm.
However, there has been several debates regarding vaccines.
Mhm.
And so, what's what do you know? Where are we in terms of vaccines? And what's the latest that you have heard there in DC?
Sure. I think the biggest challenge that we're having in terms of vaccines, there are two that are now approved, Moderna and Pfizer. I got the Pfizer vaccine, but really there's no difference. Um, they're both quite effective, almost the same amount, 95, 94%. Um, they also seem to have good activity against the various strains, the more contagious strains.
Right.
And so even if you were to contract, one of the more contagious strains, it reduces deaths, which is really kind of the bottom line, right? It's They're very well tolerated. I got my first shot. I had a sore arm. The second time, I felt tired, but then it has to do with my age. The younger you are, the more side effects you will tend to have. So
Okay.
people, say that they may have a fever, even with shaking chills. My parents, my mom, who's older, is actually got pretty nauseated and has some
Mhm.
abdominal pain. People can get loose stools. I mean, there's a whole, array of symptoms. And so,
So why is that? Just from
yeah,
as a layperson, I would expect the opposite, right?
yeah,
I would think that somebody older would have more of the side effects than somebody younger. And I'm pointing to
yeah.
myself, I'm not that young, but but
Well,
somebody younger, I would think that the reverse would be true. So why is it that younger
why
people?
is it? Okay, so a couple of reasons. This virus has really never been seen before, and one of the ways that the vaccine works, it's using, how you have the picture and it looks like those spike balls, and so
Right.
they're taking one of those spikes and they are using that to vaccinate against. So it's just that one protein that's being injected. The
Right.
trick about COVID is that it's like a stealth virus.
Okay.
The body doesn't even recognize it. That's why it can do so much damage. So the first time around that you're getting the vaccine, it's like the body is just being primed. Oh, there's something that's foreign here. And then
Okay.
when you get the second vaccine, the body's already recognized that this is something foreign, and then they're like, okay, we've got to build antibodies. This is an invader. We're gonna, go to our defense. The thing is that as you get older, your ability to what we call mount an antibody response decreases.
Mm,
It goes down. And so when you're younger, you see something that you're not used to. Think about a younger person, right? Like kind of like how they react. They react like
right.
this. Whereas an older person, either because we don't have as much energy or just, you've seen so much stuff, you're not going to react in quite the same way. So that's why there's the differences. But that doesn't mean everything that I just described doesn't mean that if you're older that you don't have a reaction. It's just that people who are above 55 in general are not going to have the same kinds of reactions that younger people do.
Okay. Because yeah, my mother had it, and my in-laws had it, and they had different responses. But
Mm-hmm.
my father-in-law has a autoimmune
Mm-hmm.
response, situation, and so that's probably why he experienced
Yep.
more side effects as a result. So
Mm-hmm.
that is a great kind of information piece for people to recognize. If you're younger, understand that you might experience more side effects than it is when you're older. So whatever you think in your mind logically, reverse that. So that's not the way it works. So what about those people that are, like I just talked about my father-in-law being immunocompromised, that have
Yes.
comorbid conditions like yourself, that might be going to like I think it's Dana here talking about somebody who's going through cancer treatment and
Yes.
their immune system is depressed.
Yes.
How is should they get the vaccine,
Oh,
and
absolutely.
the vaccine have more effect on them?
So, absolutely, people who are in any of those categories, people who have cancer or heart disease or lung disease or autoimmune disease, any of these chronic diseases, kidney disease, really anything, should absolutely get the vaccine. And let me tell you why. Because if they come down with a virus, their chances of dying or having complications are a lot higher than if they're otherwise completely healthy. So in terms of whether those people mount the same degree of an antibody response as somebody who's healthy, maybe not, but you know what? It's enough to keep them protected from dying.
Right.
And what we're going to be finding out in the next several months to a year is that maybe we'll need to get another booster. Okay, because maybe it is that after 6 months, if you're 80 or above, the antibodies decrease and you need a booster. Those are the things that we're finding out. But for right now, getting as many people vaccinated as possible will protect everybody, especially those people that are vulnerable.
Right. So, I work in media, and I love the media and I hate the media because we can only provide so much information that people can comprehend at one time.
Yep.
And sometimes when we throw it out there, when we throw things out there, the interpretation is not, we haven't been able to provide all the information. And what I mean by that, it's a kind of a long setup to kind of start talking about the variants, right? And we hear about mutations and variants and being more contagious, but not nearly as that. So we're hearing all these things floating out in the media,
Yep.
And help us make sense about
Okay.
what's happening with the variants and how
Sure.
should we be, dealing with that, and how should we be processing that information about variants being out there?
Sure. Well, I mean, it's complicated because remember, just as people in the media are learning, so are the scientists and the healthcare workforce. I mean, we're learning all of this in real time too, and so sometimes people are expecting answers when we still don't know.
Right.
And so that's why also sometimes it may feel that doctors or public health officials are giving contradictory information when really it's that information is changing and it's being updated.
Right.
So whenever I'm talking about COVID specifically, I say this is what we know now, but it is subject to change, which I think is very important and key. So yes, there are circulating strains. It's the South African, the English, and the Brazilian that are more contagious. It seems that the South African one is actually more deadly in children. Up until now, we've been relatively lucky that COVID has caused some deaths among kids, but not nearly as much as it's hit adults.
Right.
And so while the numbers are still relatively, lower in children than in adults, this one of those strains seems to be more deadly in kids.
Okay.
So, what I would say about all these variants, because it's a lot to keep track of, and if you keep
Yes.
looking, you'll find more. I mean,
Yes.
so the bottom line is this: if we can just control it so you're not spreading it, and that we just get a handle on not making it contagious, either through covering, masks and physical distancing and hand washing and vaccines, then the amount of virus that's actually circulating doesn't have a chance to mutate or to change and to escape, vaccines. So that's why it's important that we have a concerted public health campaign where as many people can get vaccinated at once so that we can just ramp this and kind of get some kind of control. Because if some people are going to get vaccinated and other people are not, or whatever, it's going to allow this vaccine to, this virus to get more wind. It's, like, I'm just trying to think of an analogy that works. You know how when you see like a monster movie or something at the beginning, if you deal with it, it's small and you can contain it. But the more that it grows, the more powerful it gets, and the more you just can't control it. It's kind of the same thing here. We had an opportunity very early on, messed that up. Not us, but people that were in charge.
Right.
And so now, they're trying to kind of contain it. But I have to say, I'm hopeful. I'm optimistic.
So can I think about it like this in terms of the variants come as the virus continues to replicate. And
Right.
for the virus to replicate, it needs a host.
That's right.
And so it needs to continue to spread. So if we can stop the spread, if we can contain the spread, we can contain the variants from continuing to be created.
Dr. Dean, that was fabulous. That is a great explanation. I couldn't have said it better myself. Thank you.
Okay, so I hope we helped out that.
That's right. That's exactly right.
So yeah, so we got to stop the spread and stop the giving it fresh hosts
Exactly.
in order to replicate. Because every time it replicates, there's
Yep.
going to be a little variant that happens, and sometimes
Hmm.
that new variant gets created. So if we stop the spread of the first one, then we can kind
Yep.
of okay. All right, I got it.
You're
So I
right.
try to put it in layman's terms, so like
Sure.
for those of us that are here. So I got there was a question earlier that somebody asked about should pregnant women get vaccinated, and I know
Yeah.
that was kind of, and there were some women that I heard that had gotten pregnant during the clinical trials, and they made it all the way through. There was no complications, and so should pregnant women get vaccinated?
Yeah. So this has received a lot of attention, and understandably. I mean, a woman is probably at one of her most vulnerable points when she is pregnant, right? Because it's not only about her, but about this developing life in her body. That's pretty amazing. So there is obviously a woman has reason to really be concerned. What
Right,
I always recommend is if the woman or the couple is planning a pregnancy, to try to get vaccinated before she gets pregnant. That's ideal.
okay,
Also, you have to understand that when it comes to pregnancy losses, 1 in 3 pregnancy actually is lost. But most of the time, women don't know it because it may just be a period that's late. I mean, it's very early on.
right,
So when we're interpreting the data, any data that involves pregnant women, we have to always have a group that's not getting the vaccine to see what that group is like, without some getting anything extra or different. We do know that pregnancies, both for the mother and the developing fetus, are very negatively impacted by COVID. COVID is a virus. So if the mother gets it, it gets passed through the placenta, through the umbilical cord. And viruses can really, just like with HIV or even herpes virus, that can really affect the development of the fetus, and that there are maternal deaths. So, in my recommendation, but of course, anything that I'm recommending on today's show or future shows really has to be discussed with the physician, clinician, nurse practitioner, physician's assistant who is taking care of the woman, mother or mother to be. But the overwhelming data is that women should get vaccinated. But I think, as with anything else, I'm not going to get vaccinated if I don't trust the person that's giving me the information. If all of my questions are not answered, if I get a partial answer and I'm kind of dismissed, that doesn't, that's not helpful. So I would say with any treatment, okay, you should always make sure that you're getting reliable information,
right.
information that you can follow up on if you have questions, and that all your questions are answered. So I know that BDO has partnered with the Black Coalition Against COVID, of which
Yeah.
the Rodham Institute is a member. And I would really encourage people to go to blackcoalitionagainstcovid.org because there's a lot of great information there. And we're hoping to host town halls that are actually going to be specific for pregnant women, and women thinking about getting pregnant, and see the impact on babies, because this is a really important question and it's an important topic.
Absolutely. And so, even on blackdoctor.org, our website, we have a COVID-19 resource center, and it's got all the latest videos and up to date information about COVID, the vaccine rollout. Um, and even specifically to your individual area. So we've got states and places where Black people are highly concentrated all over. So you can find out what's going on in your state and your city about the vaccine and COVID in general and what's going on. There was a question from Jesse in the chat room. I want to address real quick. This person says, so if I get the vaccine, why would I still have to wear a mask? It doesn't make sense.
So these are, I mean, such important questions. So
Absolutely.
uh, basically, the reason to wear a mask is that although you are protected with the vaccine and you're building antibodies, we don't know if we can still spread the virus. That's why.
Mhm.
So we know that we'll be covered, but we don't know if that's enough to protect the loved ones around us. So that's why. I wish that we could get rid of the masks. Let me tell you. I mean, I can barely breathe when I'm walking up a hill and I'm talking on the phone and all that. It's hard. It is very difficult. So I don't pretend to say, oh, just put on the mask and stop complaining. It is a pain. And
Yes.
I think, maybe I can say this, maybe I can't, but I'll go ahead and say it. Back in the 60s, when women would burn their bras, I see a day when all of us will take our masks and have a mask burning party.
That is hilarious, and I promise you, and it's funny, and that's one of the things that I don't think we talk about enough. Um, is that the doctors that are working on these vaccines, the doctors that are working on the treatments of people that contract COVID, and we're going to talk about that here in a moment. The doctors that are really talking and really advising people to get vaccinated, they're tired too. So they're not trying to give any information, and they're not trying to give you any information that's going to be confusing. That is really the only benefit they get out of it is that getting us to a healthier society, right?
Well, I think you're very generous. I don't know if that's true of everybody, especially when we think about the context of sort of the structural racism that the healthcare system exists in. So even if physicians, and let's not forget all the other people that are involved in taking care of patients, the scientists, the researchers, the nurses, who are really the true angels here, as well as the public health community, not to mention the pharmacists, et cetera, is that really the I'd like to think that everybody's pure-hearted, but not everybody gets treated in a way that's fair or equitable.
Right.
So that's why it's important to go to sources that you trust, to people that you trust, to information that is vetted and that's objective. And that's why I refer everybody to blackdoctor.org and to the Black Coalition Against COVID.org, because I know who's putting that information, and these are sources that I trust.
Absolutely. Well, thank you for that. And we do have a Making It Plain town hall series that's going to be coming up. That's sponsored by the Black Coalition Against COVID. It'll be here on blackdoctor.org next week, I believe on Tuesday. And this was going to be focused on Black women. So if you are a Black woman, you might want to, and we have all of the top Black women organizations, including social and civic organizations coming on, as well as sorority organizations coming on. So we've got a full array of Black women, and we're going to be focusing on Black women and COVID. And so we encourage you all to join that and watch that program. It's going to be great. And it's going to be hosted by Star Jones. So we've got a little celebrity power as well coming on as a host. So yeah, I got denied on that one. so um, moving on to there has been there are a bunch of Black people that have decided, yes, they're going to get vaccinated, and they're non-medical professionals. We've got elderly, and there's been a schedule that's been put out by the CDC, and most states, every state has their own kind of distribution plan, but most states have been following the CDC guideline suggested schedule. Why do you think it's been so difficult for Black Americans? Because we did something on Chicago last week, and we saw
Mhm.
that the trends in terms of Black Americans getting vaccinated is lower than the actual population numbers, but Black Americans are being infected and dying at a higher rate than
For sure.
the
For
population.
sure.
So why do you think Black Americans are so reluctant in terms of getting vaccinated?
Well, I think that the issue has many dimensions. First of all, in a city like Washington, D.C., where I live and I, work, and I'm most familiar with the issue, 84% of the deaths in people in Washington, D.C. are among African Americans, and yet we constitute about 46% of the population.
Mm.
So that's not quite double, but that's a significant increase.
Yeah.
The burden of disease, we are the seventh per capita in the country in terms of African American deaths.
Mm.
So, and I think also that when we're talking about vaccinations, you can't paint the whole African American community with one brush. We
Right.
know, for example, that seniors are much more likely to, want the vaccine.
Right.
People with chronic diseases, same. It's sort of the younger folks and people who don't necessarily have illnesses that
Right.
are, expressing some reluctance. I think also if you've had a family member or a loved one that's died of COVID, that may also impact your decision. But
Right.
when we talk about sort of the structural and social determinants of health, and so I just want to review that briefly. We tend to think that going to the doctor is what's going to determine how long we live. And
Mm.
while, as a doctor, I think that I'm important, but the reality is only 20% of what contributes to your life expectancy is by coming to see me or the healthcare system.
Oh, wow.
80% is where you're born, what zip code you live in, your education, what food you eat, water you drink, air you breathe, what's the economic development or the economic health of where you live, the quality of the schools, what
Mm.
kind of racist structure are you existing in?
Right.
So, for example, for us in wards 7 and 8, that's what we call east of the river here in DC. We've got one grocery store in Ward 8 that serves 80,000 people.
Mm.
And so you've got most of the vaccines that are available are, in one concentrated part of the city, and it takes 3 bus rides to get there to get the vaccine.
Mm.
Plus, if we're talking about African Americans from under-resourced communities, because again, African Americans are, there are rich people, there are middle class, there are poorer people, there are educated people that are not educated people, is that people have competing priorities.
Mhm.
So let's say that you are a mom and you've got 2 kids and they now have to get homeschooled basically. Okay. And let's say you've got a couple of 3 or 4 kids and you're also working at the checking up, for grocery at a grocery store. And oh, you've got an auntie who's home and you're taking care of her. And then you've got one of your children has sickle cell and you're trying to decide what you're going to do, how to get food on the table. You don't have time to take 3 buses and to leave, your family
Right.
behind. So that's what I call competing priorities. That's number one. So, for example, one of the solutions that we're trying to do here in DC is we're actually trying to do what I call focused allocation. So, what's happened in DC, as it has happened in other major cities, you've had white folks or rich folks or both rich white folks going to neighborhoods where there's vaccines and have actually been very aggressive
Right.
about demanding vaccines, so much so that they've had to put up security guards, right? And then
Wow.
you had these 2 chicks that got dressed up as old people so that they could get the vaccine. So it's again using privilege, right, to
Mhm.
jump or to game the system. So people will say, well, why can't they come to this side of town? I'm like, well, why don't we have the same number of groceries, the same number of clinics, the same number of pharmacies that we do on this side of town?
Right.
So looking at that, what we're trying to do is actually bring the vaccines to where people are and making sure that the vaccine allocation matches where the burden of the disease is. So if there are people that are dying and getting infected in one ward, then that's how many vaccines should be allocated to them. It should not be quote unquote equal across the board.
Right.
That's not equality. Equity is when you're actually meeting the needs of the community. So that's one. Then you have people with chronic medical conditions. So we know that if you have diabetes that's not controlled, you will do worse with COVID.
Right.
The good news is if you control your diabetes, your risk is no different than somebody who doesn't have diabetes. Same with high blood pressure and emphysema. I mean, I could go on and on in terms of all of these diseases. We know that Black people, especially in poor communities, have higher rates of these diseases.
Yep.
And so here in DC, the people who've been vaccinated have been people 65 and over. And then beginning in March, we're going to vaccinate people 16 and over who've got chronic medical conditions.
Right.
So, for example, in a place like Ward 8, that's a lot of the community. Okay. But there has to be a different way of doing things where you're really looking at where the resources are needed and not just playing a numbers game, right?
Yeah, I've been reading some articles about that, and they're calling it line jumping.
Yes.
That's happening all over the country, where you've got people in more affluent areas are now making the appointments and taking the vaccines that are designated for Black and brown areas or poor areas. And it's not always that Black and brown areas are poor, but
Right.
they're moving into the kind of less affluent communities. They're going in there and they're making the appointments to get the vaccine, and they're jumping the line when those vaccines are designated for the people in that community in that area. And so that
Well,
is
if I could just say this, Mr. Dean, I mean, how is this different than anything else? No, I'm serious, because I mean, COVID is just the latest example. You know, resources are never distributed fairly. I mean, that's the economic inequity, justice, health. We could go on and on.
Yeah.
The educational inequities, and then yet we hear people saying, "Oh, but we shouldn't have to pay taxes." But people are getting all the benefits, all the perks, and yet don't want to actually to allow other people to have even 1/10 of what they have.
Right.
So, I mean, I could go on for a long time just to talk about this issue, but I do think it's important because people get labeled, and this is, they're saying, oh, people don't want to get the vaccine. They're, they are reluctant and so forth. Well, first of all, BDO, as you mentioned, and the Black Coalition Against COVID have done a lot of town halls to help educate people, right?
Right.
That's number one. Number two, and in that education, I mean, I had a patient the other day. I said, so are you going to take the vaccine? He's like, no. I said, why is that? He goes, well, I said, I'll tell you why you're saying no. I said, you've been reading about the Nation of Islam and what they're saying, right? And about the that you shouldn't get vaccinated because of this is going to track you. I said, first of all, let's see who is dying of COVID. Who is dying of COVID? Okay, it's black people, right? And then second, you're worried about being tracked. Guess what? You're being tracked all the time. Third thing, you are concerned about something being put in your body. And I'm not meaning to minimize these arguments. What do we put in our body all the time, from the food or the water or the air or the tobacco or any of these things? So, but the bottom line is, who is dying of COVID?
Yeah.
So everybody has to make a decision about the vaccine that they feel comfortable with.
Yeah.
But, I mean, I think, like I've told you before, I truly believe that this has been a passive genocide where Black people, brown people, people with chronic conditions, older people. There was a calculation at the beginning of this pandemic by the former administration, and they said, you know what, if these people die, who cares?
Right. So I want to address one quick thing that's been going on in the comment section, and that is the speed of the development, or the alleged, that it was developed too quickly. And so I'm going to speak from what I've learned after doing several of these interviews and watching a lot of and producing some of our Making It Plain. The mRNA technology that was used to develop the Moderna and the Pfizer vaccine has been around for 7+ years. It's been around for much longer than that. That technology was already in existence. So that wasn't something they developed at the point of this vaccine. Also, this is the first vaccine where we've had worldwide cooperation and worldwide focus on developing one vaccine. So yes, to your point in the comment section, an average vaccine might take up to 4 to 7 years, and that is because they're going through slowly. They're using fundings from their own information, and they have the luxury of taking time. This is a situation where we had world governments and all of the pharmaceutical companies coming together at one table and saying, we've got to work together to develop this vaccine, to develop a vaccine as quickly as possible. So that's where, so they didn't skip any steps in terms of the phase 1, 2, 3, 4, and all the trials. They didn't skip any steps. They still followed all of the rules that are in place, regulations in place to develop a vaccine. It just got done in parallel versus in sequence.
That's
So,
right. That's
okay.
a very, very important point that you make. As a matter of fact, one of my colleagues who used to be at my institution at GW in DC was actually very close to developing a coronavirus vaccine. It wasn't the COVID vaccine because it was not this particular strain. And he was very close to developing it in 2016. Then that previous administration cut off all of his funding.
Right.
So there had already been a lot of research work. And
Right.
to your point, if we as human beings have a problem and we all work together, we can solve this. And so because we were all in crisis, the competition was to, figure out a way to get the vaccine, and so people really work together in a very positive way.
Yeah. Yes. Okay. So thanks. So I just had to get that off my chest because I hear that from time to time, and I still hear it as we've been doing this. And I wanted to make sure that people recognize that was this done quickly? Yes, but this is unusual circumstances, and so they didn't do anything unusual. They just did it faster than what traditionally happens.
Yeah, but as you said, the technology has been here close to a
Yeah.
decade.
Yes.
And the other thing that should be reassuring to people, as opposed to other trials where you have much smaller numbers of people who are enrolled,
Yes.
you now have millions of people that are enrolled. So if there are problems, we would see them. These are actually much safer than the majority of vaccines that we get. So that's another way of looking at it. Just by sheer numbers, if there were problems, we would have really seen a lot of them.
Yeah, and so and just for some context for people that are watching and that are still on the fence, if let's say, Lord forbid, if somebody has an adverse reaction, right, and to the vaccine, we can't hold that one up as, see, this is a bad vaccine. When right now, if you look on the CDC website, over 70 million people have received at least one dose. Another 40 or 50 million people have received both doses of this vaccine and haven't had any adverse reaction. So yes, this is where I said this is my hate part of the media. The media is going to take that one person, and we're going to see that all over media saying this person had an adverse reaction. But what they're not talking about is the 70 plus million people that did not have an adverse reaction to this vaccine. And so that's where we have.
Well, you know what it's like is seatbelts. Seatbelts save thousands and probably by now millions of lives. Maybe once in a while a seatbelt would have constrained somebody in a way that they may have died.
Right.
But the millions of people that have been saved versus the one, really highly unusual, to your point.
Right. So I just have to, there's some things, and I just want people to really recognize and add some context, right, to what's happening. And that's why we have these discussions. And I know we talk about COVID every week. We talk about COVID all the time.
Yeah.
At the COVID Resource Center, but we really have to give some context to when we're talking about the potential negatives, right? And so the only other thing, and then we're going to talk about what are some resources people can do to find out about where they can get vaccinated, is the only other thing I want people to recognize is the vaccine, which is why you still have to wear your mask even after you've been vaccinated, is to stop the spread. And you can still contract COVID. What the vaccine does is it prevents the death. It prevents the more severe reaction from if you do contract COVID. So you can still contract COVID even after you've been vaccinated. You can still spread COVID even after you've been vaccinated. The vaccine is to reduce the death, and it's not to prevent you from getting infected. And so I think people hear vaccine, they think, well, I get the vaccine, I'm not going to be infected. No, you can still be infected. It's just preventing you from having the most adverse effects,
right,
which is death.
Which is just like, by the way, the flu vaccine. But you know, as you're talking, and we are all so saturated about COVID, right? It's like, can we just have another another tune that we can play? Because it's just getting so old. One of the things that I just want to kind of bring up and discuss with the audience is that there are other illnesses that are happening. You know,
Yep.
we don't want to forget, and you know, we don't want women to forget to go get their mammograms, or people to get the colonoscopies, or not coming to the doctor because, and you know, needing to get your diabetes checked out, or if you've got blood in your stool, to say no, 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 I'm worried about COVID. And then the other thing that I'm really seeing a lot in clinic, and this is being reported all over, the mental health toll. I
Yes.
mean, my God, I don't know about you, Ellis, but I can say this: I've had some meltdowns. No, I'm serious. Boo
Right.
hoo crying. I can't take this.
Yeah.
This is very hard. I miss my friends. I
Yeah.
miss going out. I miss going to a movie. I miss dancing. You know, I
Yeah.
love live music. I mean, this is hard. And we're going into our second year. So I
Yeah.
think, you know, in dealing with all of these issues, it's okay to say, you know what, I'm sick of this, or I'm gonna take, you know, a COVID break, meaning that I'm going to do something that's not at all going to remind us. But I have something to ask you. When you watch the movies now on TV, don't you say, wear their masks? I mean, are you finding yourself saying that? I'm like, wear their masks.
It's funny. It's like it's definitely. I see them now, and I get jealous, and I go, "Why are they so close together? Don't they know
Exactly.
social distance?"
Exactly.
You're absolutely right. I mean, I heard. I try to do things to feel normal,
Yes.
and normal being pre-COVID, kind of
Yes.
all that period pre-COVID. But you're right. I have had some. It has been difficult for my daughter went off to college, right, and so and they had it. She was in the dorms, but not in class, and so but you're
Right.
still there, and you hear about all of these COVID spread on college campuses, and so not
Yep.
only I'm concerned about myself and but I got to be concerned about her. She's not here,
Yep.
and it's just been there is a mental health fatigue and drain, and
Yeah.
that happens, and so we do want to acknowledge that. So if you have a resource, please utilize it, even if it's just calling your friend and getting on Zoom and looking at their face, because you can't touch them and hold them or whatever. Find a way to be able to unload that burden mentally, because it can be overwhelming for many people.
Well, and I would say this, you know, I mean, as I say, I just had clinic earlier. I'm like, how are you doing? I'm fine, but there are so many people that have it worse than me, which is a true statement. But you
Mhm.
know, my great grandfather said that you have to hold two simultaneous truths in your hands. One, you're one of billions, but you are also the most important person in the world. This
Right.
is your life. And yes, gratitude is very important, but it's okay to say, you know what, you know, this is hard. You
Yeah.
don't have to put on the smiley face all the time and pretend. And I would say, especially among our young people, I mean, you know, we're hearing about, you know, suicides and anxiety and depression. So I think when we're vulnerable, we have to be very, we have to take it easy with ourselves, and we've got to take it easy with others. We have to be tender because it's like a live wire. We are exposed right now.
Yeah, and I think as Black Americans, we are used to wearing that Paul Lawrence Dunbar mask that he describes, and so it's hard to. We've been trained since birth to wear a mask in America, and this is not the time to do it. When you get home, you got to find some place where you can take that mask off and be vulnerable
Mm-hmm, mm-hmm.
and share and talk about how you're feeling, so you can get it out. Because if you don't, it can really add to that stress level and
Yep,
exacerbate any conditions that you may have, or cause one that you don't have. So
that's
you got to
right.
be really, really careful about that. So as we're wrapping up here with Dr. Gigi, House Call with Dr. Gigi, and we're looking forward to more episodes of House Call, and not always talking about COVID, but we're going to talk about COVID today. Um, Dr. Gigi, how can somebody, if they want to learn more, if they want to get vaccinated, what do they need to do?
Mm-hmm. So, you know, the rollout is improving. But unfortunately, now you have to really check with your local Department of Health.
Yeah.
Um, right now, the way that the vaccines are being distributed, and I think we'll probably see this change because the federal government is looking at changing the way the vaccines are going out, but they're pretty much going out to hospitals. The Biden Harris administration is going to be sending many, many more doses to pharmacies.
Yep.
And here in DC, we're actually trying to use community sites. One of my colleagues in Ward 7, Dr. Reverend Curry at Pennsylvania Avenue Baptist Church, has had vaccinations there. I think that that's a good thing. It makes it just a lot easier.
Yes.
And I think, one of the some of the groups that we tend to forget about are what I call the minorities within the minorities. I mean, disabled people living in Ward 8, people who have mental illness, seniors who are shut-ins. I mean, this is like a double burden. But I would say go to your Department of Health's website, contact your doctor, nurse practitioner, PA, and find out what the policy what vaccine supply. I think right now, vaccine supply is the rate limiting step. At least here in DC, I think we only get like 17,000 doses a week.
Right.
So, and then we may be experiencing some delays because of all the weather, the snowstorms, and so forth.
Right.
But the Biden-Harris administration is really cranking up the production. So there are going to be like 100 million doses released very shortly. So hopefully that will become less and less of an issue.
Absolutely. So just to reiterate, contact your local Department of Public Health. It's just a Google search away. If you don't have a Wi-Fi, you could do it on your phone. Everybody, and I did all the research. So 95% of people have some sort of smartphone technology. So you can always check via your phone and Google your local health. And then and some places have applications. You can get on the wait list. You can get in, they'll reach out to you, but always check back and make sure where you are in the schedule. So the CDC has a schedule, so you can kind of look. And then there's there's going to be some. Go to the COVID Resource Center, and you can find all the information about where you are in the line. We want to get back to we want to get that herd immunity.
Yep. And I also want to say that, for people who may be blind or, as you said, don't have internet or whatever, we're in a community. We have to look out for each other, and we have to advocate for each other. You never know what somebody's going through and what barriers they may have. It may be that they just want somebody to accompany them to get vaccinated. And I also want to say that the food piece, I mean, the number one social determinant of mental health is food. So that's why, these food banks are running out of food. And so we have to look out for each other, whether it's our mental health or making sure that people are eating or getting vaccinated, because that also impacts our health, right?
Yeah. Yeah. Well, we're going to let that be the final word from Auntie GiGi. It has been a wonderful, wonderful experience. I thoroughly enjoyed talking to you, and I'm looking forward to this series of House Call with Dr. GiGi. Thank you all for joining us. Thank you all for your comments. I know I can still see Michelle. I saw you the other day. You are banging that drum, and we're going to be here. But I thank you for at least joining us and asking the questions and putting it out there. Thank you all for your debate. It's healthy debate. We need to have these discussions. If people are ready to get vaccinated, get vaccinated. Black people, if you want the vaccine, go get vaccinated. If you're on the fence, come back, keep checking the resource center, get more information. If you're no, hey, that's your choice too. Okay, so we're not telling you what to do. We're just trying to give the information so you can make the most informed decision. And that's all I have to say about that as Forrest Gump. So again, thank you, Dr. GiGi. Thank you, Auntie GiGi. Thank you everybody for joining us. And we will see you in a couple of weeks on House Call with Dr. GiGi.
Bye.